Today we'll talk about an important topic, that is sexual problems in men and women. Sexual problems in men and women. See, as the age is advancing, as the age is growing, as the age is advancing, there is no contraindication. There is no contraindication for sex. Only thing is you can maintain. You have to maintain your physical fitness. You have to maintain your physical fitness, and very 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 important thing is, from the beginning I am telling you, 80% should be, you must take care in the diet, and 20% on exercise. Daily you must concentrate 80% in diet, 20% in exercise. So what are all the problems that can come to the male and female? So particularly male problems, male sexual problems we'll talk first. Number one is premature ejaculation. Most of the males, 70% of the males, they complain of premature ejaculation. What is premature ejaculation? See, normal sex is usually between 2 minutes to 10 minutes. 2 minutes to 10 minutes is usually normal sex. It can be beyond, that's a different issue, but normally 2 minutes to 10 minutes is the normal sexual time. But 5 minutes is the average. 5 minutes is international average. 2 minutes to 10 minutes, anywhere sexual act is okay. But 5 minutes is the average. Suppose you are ejaculating just within 1 minute. Sometimes, see, premature ejaculation is called when you ejaculate before 1 minute, within 1 minute. After there is erection, you start participating in sex. Immediately you start, immediately there is ejaculation, or after participating in sex, little after, before 1 minute you are ejaculating. This is called premature ejaculation. So less than 1 minute is called premature. That wonderful medication is there for this. Tablet Duralast, 30 mg 3 hours before. You have to take this tablet minimum 3 hours before the act, sexual act. So for example, at least 3 hours before is the best time. So Duralast tablet for premature ejaculation should be taken 3 hours before, at least 3 hours before that. Remember, so 30 milligrams, Duralast 30 mg is the medication. Next comes impotence. Impotence is mainly a psychological aspect. If it is pathological, you have to go to the urologist, also called andrologist, but mainly it is psychological. And what is impotence? That is, you are not getting sufficiently hard. That means you are not getting sufficient erection. That is the problem. So for that, there is a wonderful medicine called Tadalafil. The Tadalafil, you can start with 5 milligrams. 5 milligram will be enough. Tadalafil 5 mg. It is called Cialis, Tadalafil, so many things. Tadalafil 5 mg. 1 hour before. It is advised 1 hour before, just 1 hour before, you must take Tadalafil. There is one contraindication to this tablet. Tadalafil is not indicated for only some people who already had a heart attack, and particularly on the patient is on nitrates, that is sorbitrate, monotrate. These are the tablets. Suppose you are taking sorbitrate, suppose you are taking monotrate, that is isosorbide dinitrate, or these are the tablets. Nitrates, particularly nitrates, if you are for heart attack, if you are using these particular tablet, then Tadalafil you are not supposed to take. Rest of the people, anybody you can take. Only when a person is on sorbitrate or monotrate, nitrates we call them, if the patient is taking particular tablet, you are not supposed to take Tadalafil. Rest of the people, whether you are diabetic, whether you are hypertensive, whether you are taking any other medication, you can take Tadalafil. Tadalafil is very safe. 5 milligram 1 hour before to prevent this particular problem, impotence. So male problems are mainly two. Rest of the problems you don't see in males, but in women, in females, you find small problems but different type. Number one is dyspareunia. That means pain in the lower abdomen, during during the sexual act. Pain in the lower abdomen pain will be little severe, and it will be very very uneasy. For the females, particularly young ladies, particularly young females, because of pelvic infection. They may be having infection nearby the uterus or in the appendix or anywhere. Sometimes around the uterus they will have, this is called pelvic inflammatory disease, and by doing an ultrasound scanning you can know it, and I think you must see a gynecologist for that. Dyspareunia is an important topic. And next is leukorrhea, that is white discharge. Leukorrhea is white discharge. White discharge is also very, very common in females. For that you can take tablet Metrogyl 400 mg 3 times daily, and Candid vaginal cream. Candid vaginal cream can be applied inside the vaginal area, and regularly, at least for a period of 1 week. So Metrogyl should be taken at least for a period of 5 days, morning, afternoon, night, 400 mg, and Candid vaginal cream can be applied locally, not less than about 15-20 days, like that. I think you will get relief. Number 3, urinary tract infections. Frequent urinary tract infections is another trouble in females, particularly after sex. They will have a lot of urinary tract infection, not exactly urinary tract infection, burning sensation in the urine, etc., etc. If it is urinary tract infection, if it is recurrent, repeating on and off, then usually gynecologists advise tablet Furadantine. This is one tablet Furadantine, Furadandin, 100 mg, Furadantine 100 mg daily at bedtime for a period of 2 to 3 months. Daily at bedtime for a period. Tablet Furadantine daily bedtime for a period of 2 to 3 months regularly, to prevent recurrent urinary tract infections. And lastly, there may be dryness. With increasing age, there can be dryness. For that you can use some KY jelly. Any lubricant is good, but KY jelly is supposed to be very, very good. So please, these are very, very common problems which can be treated. You can go to the gynecologist if there is, if you are a female, and if you are a male, you can go to the urologist, also called andrologist. You can clear your problems. These are minor things, but if you have any other problem, difficult problem, you can definitely see a urologist or andrologist. You call urologist.